As a community that has a lot of resources, we also have a lot of needs.
Right now, our most important critical need is mental health services.
It's not possible for us to take the best care of our patients without addressing the mental health issues.
The impact on the community is huge, both financially and emotionally.
It's hard to sum up someone's life, especially when, someone who died so young. I felt that he was just getting started. Of course, one of the first things that people recognized about Dex was he was incredibly bright. Great skier, great snowboarder, great mountain biker. He did all the things that you would expect a well-rounded kid up here in the Wood River Valley to do. His friends loved him. We lost my son to suicide as a result of mental illness. I was totally unprepared for his death, for one thing. I never saw that coming, and I really wasn't prepared for how to deal with the issues of mental illness. I'd never experienced it. It wasn't part of our family.
Virtually every family in this valley at some point will be touched by either mental illness and or substance abuse. We are certainly not immune. We've seen both an increase in the amount of stress on our local residents and an increase in depression and decreased access to mental health services. What this does is people present to the emergency department in crisis when they have no place else to go.
But what we really focus on, and what's really our passion and our practice here at St. Luke's Family Medicine, is the continuum of care, the ongoing relationships with our patients. And it's so painful, just literally painful for us to see patients be in these significant emotional crises with us not being able to have the team and the services. It really highlights the mental health area as being by far the most significant unmet need that we have in our community.
He went away to college, and unfortunately, I think that's when his symptoms started to show.
Dex needed help. So when he returned to the valley to get that help, I had been challenged by a feeling of a lack of resources or fear, not knowing where to turn. And so I'm really moved that there is a turn in the entire community, and now I think brilliantly led by St. Luke's, that we're going to start paying attention.
So this initiative is basically a partnership between St. Luke's Wood River Medical Center and the philanthropic base of the Wood River community to say we're going to provide professional board-certified psychiatrists, licensed professional counselors, and integrate them with the existing medical professionals in the community to provide a broad base of outpatient services that treat mental illness on a daily basis with appropriate support and early intervention.
Gathering those resources and further developing them here in the community, as St. Luke's is trying to do, is really what needs to happen for us to take the next step forward in providing services for everyone in the valley.
I really think that it is very exciting that we might actually start to solve a community problem.
The ability for us to be able to get help from our community is so essential in this area. That makes such a difference for us as practitioners, but more importantly for our patients and therefore our community.
After losing Dex, we feel an exceptional desire to be advocates in this.
To spare someone else for going through
As painful as it is. I think that the energy could get rolling to really make a big difference.
We're truly grateful for the vision and commitment of our donors who have made possible a level of services and quality of care seldom seen in a small rural community. As we work to make our community as healthy as it can be, we hope you will partner with the St. Luke's Wood River Foundation and invest in the launch of mental health services for our community.